Hi everyone, this is Dr. Sri Karthik, first semester junior resident from the Department of Pediatrics, AIIMS, New Delhi. I did my UG from Government Dharmaburi Medical College 2019 batch, and I got MD Pediatrics in INICET November batch. And Kandipa in the last 1 month of INICET preparation will be a very big or a customer situation because a lot of things will come into our minds, right? The question pattern, the exams, the future, our interest of batch. But what I suggest இதெல்லாமே கொஞ்சம் நாளைக்கு தூரம் வச்சுட்டு just focus on the examinations, the pattern of the examinations. I used to tell to a lot of my friends that this INICT, when compared to NEET PG, is more like a patterned exam. Okay, it's a structured exam, it's a patterned exam. There are a lot of topics which get repeated over years together. So if you're thorough with that particular topic in and around, for example, if there's a question that gets repeated, a particular topic, you should be thorough with all the 4 options that has been asked in the topic. So appaduma padichomna, it is very easy to crack INICT at any moment of time. Sila rendu moonu vishayangal onnu, of course it will be tough, but mental peace do matter a lot because எந்த ஒரு ஸ்ட்ரெஸ்ஸும் இல்லாமல் இருக்க முடியாது. பட் as much as possible, like have a clear mind, have a structured pattern in your mind. Yes, this is all the topics I will learn in the subject at this moment, because anyone can learn at any moment of time, but how much you retain really matters a lot. So இந்த நாள் நம்ம எவ்வளோ படிச்சிருக்கோம்னு முக்கியம் இல்லை, பட் இந்த லாஸ்ட் மொமெண்ட்டில் என்னென்ன டாபிக்ஸ் என்னென்ன சப்ஜெக்டில் நான் கவர் பண்ணணும், ரிவைஸ் பண்ணணும், அதுதான் இங்கே ரொம்ப முக்கியமாக அது இருக்கும். ஸோ தட் ரியலி மேட்டர்ஸ் அண்ட் தட் ரியலி சேஞ்சஸ் த ரேங்க் between the toppers. So there's no so-called toppers, and the toppers category எல்லாம் இங்கே கிடையாது. If you revise well, if you are good with your topics and the concepts, anyone at any point of time, at any point of preparation can clear this examination, provided you should be thorough with that particular topic and solve questions, the previous year questions as much as possible. So அதுதான் என்னோட ஒரு not an advice, but from my point of approach to the particular INICT na சொல்லுவேன். Next important thing like always give preferences. Of course, many of you might know that first 2-year subjects are very important, like ANAT, Biochem, Path, Micro and Pharm are very important from my aspect, physiology as well. So because like from the exam point of view, if there are 15 questions that has been asked from microbiology, at the same time another 15 questions that has been asked from the medicine, which subject will fetch you more marks? That really matters, right? So if you are very good at the basics of microbiology concept, அது உனக்கு தெரிஞ்சிருந்துச்சுன்னா அந்த கொஸ்டின் கரெக்ட் ஆகும், தெரியலன்னா தப்பாயிடும். பட் மெடிசன் யூ கான்ட் எக்ஸ்பெக்ட் த சேம், பிகாஸ் அது பியாண்ட் அவர் நாலேஜாக இருக்கலாம், இல்லாட்டி பியாண்ட் த ஸ்கோப் ஆஃப் நாலேஜாக இருக்கலாம், அது படிக்காத டாப்பிக்காக இருக்கலாம். ஸோ இட்ஸ் அ வாஸ்ட் சப்ஜெக்ட் அண்ட் இட்ஸ் அ கிளினிக்கல் சப்ஜெக்ட். ஸோ நாட் ஒன்லி ஃபார் மெடிசன், சர்ஜரி, பீட்ஸ். ஸோ அஸ் அ ஹோல் நான் என்ன சொல்கிறேன்னா, first if you are in the state of preparation, just be thorough with the first 2-year subjects. Okay, medicine, surgery தவிர first 2-year subjects நம்ம தரவாக இருந்தாவே we can able to get a lot of questions right, and that will add on to the number of questions that become right, and that eventually be reflected in your rank. So அதுதான் என்னோட இது. ஸோ have a structured pattern. நான் என்ன சப்ஜெக்ட் ஃபஸ்ட்டு படிக்க போகிறேன், அந்த சப்ஜெக்டுக்குள்ளே என்ன டாபிக் படிக்க போகிறேன்னு உங்களுக்கு அந்த நெக்ஸ்ட் இந்த 1 month, not really a 1 month, okay, it's less than a month. So have a structured exam. Last 10 days be free, just revise, don't get into complex topics or don't learn new topics, just be with the notes that you have already prepared, revise the topics as much as possible, be stick on to the previous year questions, and not just promoting this, but Ranjit sir is my college senior, is a like he in this amidst the PG like the work pressure and all those things, putting effort in making work easier for the preparing aspirants is really a good task. Like ஏன் சொல்கிறேன்னா, if you are already into this preparation for months together or years together, then you know where you have to stress, where you have to focus on. But if you are in the late months, like இப்போ தான் படிக்க ஸ்டார்ட் பண்ணிருக்கேன், எனக்கு என்ன ஒரு அப்ரோச் தெரியாத பட்சத்தில், but even if you are good at your subjects but you are not focused about where to focus on, and there comes the importance of that நமக்கு தெரிஞ்ச the Paul PDF, because last month like it has become many people, not just from my colleges, from other colleges also they follow this. Even some rankers from AIMS also they have said that yeah, they have followed this, because I guess around 130 questions have been asked from the topics that has been mentioned in that PDF. So yeah, you can have that PDF as your guide, okay, so that you can see what are all the topics that has been repeated, and you learn from the source where you are preparing it. So it gives you a guide. And yeah, so be happy, prepare happily, amidst all the stress that you are going through. Ultimately at one day you will get freed of everything. So think about that, and just at this moment don't think about anything else than giving your exam best to the possible. So yeah, read well, revise well, retain the contents as much as possible, focus on the first 2 year subjects as much as possible, and do solve the previous year questions. So again I'm telling, INICET is a more patterned and structured examination. So be smart enough to crack the exam. So any doubt you can ask any of the seniors, like even me or Ranjit sir, so we will definitely there for you. And yeah, do follow and do have a look through the Paul PDF so that you can get some really good stuff from that. Thank you.